If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got our guy, Dr. Ben Kosubevsky, back here again with Longevity Center. So thank you for coming in. I know you're a busy dude.
Yeah, no, happy to be here. It's always a good conversation.
And to remind everybody, right, you're a DO at your center is Longevity Center. It's in West Palm Village, right? Yep. Explain more about what y'all do and how y'all help people.
Yeah, so we do, if it exists in the functional, regenerative, or integrative space, we probably do it. So direct injections with PRP and stem cells for joint injuries, spines, shoulders, knees, hips, you name it. We do intranasal and IV stem cells for brain and whole body support. And the other part of what we do is IV based. So ozone therapy, chelation, NAD, methylene blue, ALA, basically all the IVs that exist we offer. And a lot of what we see is what I call the atypical chronic illnesses. That's like you're chronically ill, but like your regular doctor doesn't know what to do with you. So like Lyme, Epstein-Barr, mold, heavy metals, stuff like that.
Yeah. Which is, it's a bummer because it's kind of like, it's not shunned. It's just not looked upon in a objective light. I feel like in Western medicine, allopathic settings, where it's like, then they don't feel good. They're not right. Mm-hmm. What do you do? Yeah. That's where y'all come in.
Yep. Because I went to regular medical school. They don't teach how to do any of this stuff. And so like, I guess, when they go to like my colleagues that do regular quote unquote medicine, and they have chronic Lyme disease, they have no idea what to do. Put you on antibiotics and wish you luck.
Yeah, exactly. Kick a can down the road, put it to somebody else. Yeah. It's a bummer. Because they want to help people, but remind me, where'd you go to med school?
It's called LECOM. It's in Bradenton, Florida.
Oh, okay. Yeah. And then where'd you go to undergrad?
It's Fairleigh Dickinson. It's up in New Jersey.
Oh, okay. Are you from that area?
I'm from New Jersey, yeah.
There, because Matt and Gian are from Monmouth County.
Oh yeah, that's where I'm from too.
Oh really? That's funny. That's awesome. They're always telling me cultural stuff up there that I'm just not familiar with, and I'm like, I'm a South Florida kid. Like I don't, it's just not my thing. So what led you to get into functional health, like medicine, functional health?
Yeah. So I got my first introduction with stem cells. So when you're in med school, they send you off to like go do rotations with different doctors, and you have to do electives sometimes. And that means you basically have to go find your own place to go stick yourself for a month. So I was talking to a friend of mine and she was like, oh, you should go be with this doctor. I was really into osteopathic manipulation back then, the hands-on stuff. And she's like, oh, he does a lot of it. Go spend a month with him. You'll really like it. So I get to his office and he does very little osteopathic manipulation, but he did all these things, stem cells and IVs and all that stuff. I was like, this is pretty cool, but does it work? Yeah. So I was like, can I do another month with you? And he's like, sure. So I spent the second month with him and you start to see people come back and some were like, actually, I am starting to feel better. So back then I had really bad neck pain, headaches, and TMJ from a snowboarding accident. And so I was talking to him and I was like, is there anything you can do? Because the TMJ is killing me. I can't wear like headphones because even the pressure of that is too much on the jaw. And he's like, oh yeah, we put stem cells in there all the time. It's no problem. I was like, listen, I don't have a lot of money, but I really don't have anything to lose. I was still in school. I had no money. Yeah. Like I got nothing to lose. So let's try it, see what happens. So he does the injections in my jaw and my neck. The neck pain was, sore for whatever. I couldn't open my mouth for 4 days. I was on like a liquid diet for 4 days. Then on day 5, my jaw like cracked open. And that was like 10-ish years ago. I haven't had pain since.
Wow, that's amazing. Mm-hmm. So that experience where you were like, I'm getting into this.
Oh yeah. So after that, I was like, listen, I spent like 6 months with him in total. My school kept letting me do it. I don't know how. But I spent 6 months with him and I was like, listen, I have to go do residency, but will you hire me when I'm done? And he's like, actually, I want to open an office in Jupiter. So do residency, stay up there and open it. So worked for him for 4-ish years up in Jupiter. And then he and I parted ways. I started my own place.
Interesting. And then that split, you started your own place.
Yep.
When was that?
A little over 2 years now.
And then you also have a spot in South Carolina, right?
So we have 3 offices now and the 4th one coming. So we are in West Palm Beach off Village Boulevard. That's our main location. Then we have a second office in West Palm at Hippocrates Wellness, if you've heard of them.
Yeah. I've been there.
Oh yeah? You did stay?
I haven't stayed, okay. But I visited and toured the facilities and met a lot of the practitioners in there. Yep. Really cool. It's a cool thing because it's like full immersion full compliance,
Yeah.
which is huge.
Mhm.
Met the owner.
Yeah.
It was a cool spot.
So we've got their office upstairs there, and we're just basically partnering with them because a lot of what they do is complemented by IV therapy. And a lot of IV therapies, they work better if you eat really clean. Who would have guessed that, right?
Yeah.
So if you eat clean, take care of yourself, de-stress, the IVs work better. So especially stem cells. They love a nice, quiet environment. And then we have a third office in Greenville, South Carolina. And then I got the lease this morning, so I haven't signed it yet, but I'm looking at it, in Orlando. So we're aiming for
Sweet.
October.
Wow. Amazing.
Mhm.
That's really cool.
Yeah.
Do you have another practitioner like yourself on board, or are you traveling?
So I have a nurse practitioner in Greenville. I have a nurse practitioner in Hippocrates. I mostly run our main office. We call it 580 because that's the street number. And then we're going to hire someone else for Orlando. But I travel between them doing procedures, and they do all the IVs.
Hire another nurse practitioner in Orlando. Yeah.
Yep.
Yeah. That's cool. Well, congrats. I mean, it's awesome.
Thank you.
I mean, in my opinion, I feel like this has amazing applications, and it's like the future of medicine.
Yeah.
And also looking at the lens of hey, when you eat clean and you live a more healthier lifestyle, which would include physical exercise, activity, eating healthier, these things improve the efficacy that when you deliver.
Yeah.
I think, and also the lens of I don't want to get your opinion on this, but where do these chronic diseases stem from, as in autoimmune, Crohn's, and multiple sclerosis,
Yep.
stuff like that, or IBS, all those, just rheumatoid RA, right? Where do they even stem from in the first place?
So,
what do you think?
one of those is not like the other, and that's IBS. IBS is symptoms. Having constipation, diarrhea, that's symptoms. Now, if you have Crohn's or ulcerative colitis, that's separate. But if you have just true IBS symptoms, no clear source, that's just a symptom.
Okay.
But RA, MS, Crohn's, I forget what the other one you said was.
MS, RA,
Yeah.
Crohn's, IBS.
Maybe there was one before.
Yeah.
But the other three, so autoimmune diseases, in my opinion, they're either genetic driven or toxin driven. They don't just start out of nowhere. Your body doesn't just wake up one day and go, I feel like attacking myself. Let's have a party.
Yeah.
So it's either something in your genes is telling it to do it. And if it's not genetic, which if you have no family history, and nowadays they've got genes down, they're not perfect at, but they've got it pretty good at them. So if you do a genetic test and there's nothing in your genes that point to autoimmune, it's probably toxin driven. Environmental stuff like pesticides, glyphosates, microplastics, heavy metals, lead, mercury, etc. Epstein-Barr has been linked to multiple sclerosis really well, actually. So chronic viral infections.
Does that, along that line, so I have been, my understanding up to this point was if somebody has an underlying genetic predisposition, environmental toxins and exposures will trip that genetic expression to then deliver, right, what like an autoimmune response.
Yeah.
So it's always been underlying. So it's if you remove the trigger or improve that, will that resolve the autoimmune issue?
You can't put the genie back in the bottle sometimes. So sometimes yes, sometimes no. And then I think also varies. If you look at Huntington's, which is a fully genetic thing, there is not really a toxin trigger for Huntington's. Chances are that one, if there was some kind of trigger, it's not going away. But then you look at other ones, and it's not really genetic, but ALS. Here's an interesting fact about ALS. The military considers a diagnosis of ALS to be 100% disability. Why?
It makes sense. You can't function.
Yeah, but it's not, you don't get diagnosed with ALS when you're military. You get diagnosed with it 30 years later when you're 50 or 60 or 70, right? So they clearly know that there's an association between what you do in the military and developing ALS later. And unfortunately, in the military, they're exposed to a ton of garbage. Between all the vaccines they receive, there's probably a bunch of heavy metals in there. What they're exposed to, bases probably have mold, especially overseas. And then all the chemicals that are constantly sprayed around there, and then just lead from bullets and guns and all that. I know
recently with that running back Chris Johnson got exposed, he came out with his diagnosis. He's, it's crazy to see that his ALS progression already. Oh my gosh, it's a bummer. But just because he was a prolific, one of the fastest dudes in the NFL ever, running back, and then now he's like wheelchair bound. You know, can't even move.
Yeah,
it's a bummer. But anyway, looking that up, like what I was reading was there's like a 4.5%, 4% or 4x likelihood comparison of football players that develop ALS, NFL players that develop ALS. So there has to be some kind of trauma shear component that exacerbates a response like that.
I think there's two parts to it. One, there probably is some kind of traumatic brain injury instigating effect, but also football fields, the amount of paints, pesticides, and garbage that they pour on there that make them look that clean, and those players are literally face first in it, breathing it up. I think that's a big part of it too. Or turf fields.
The turf.
Turf is even worse.
I've heard that argument before.
Yeah.
You know, like the turf. What about, I mean, I guess my thought on that would be soccer. They don't have the same correlation likelihood of developing ALS compared to football. So
you probably, like you said, there probably is some kind of traumatic brain injury component, but also I don't think football players, they literally get shoved into the dirt all the time.
Yeah, they're true. They're on the ground. Yeah. That's a good point. But anyway, like, and another one I was a question on is something like type 1 diabetes, like, you know, juvenile onset diabetes, where once the genie's out of the bottle, you really can't put it back. Is that accurate?
An interesting one.
Or is type 1 different?
So type 1, yes, an autoimmune disease that causes destruction of the pancreas. But there is a medical clinic in Germany that at the end of 2025, they came out and said, we have cured type 1 diabetes in this patient using stem cells. So I think if you're willing to pay them, I have no idea how much it costs, but you can Google their clinic, just type 1 diabetes, Germany, stem cells. They'll come right up. You can call them, see how much they cost. I think they're willing to take patients. Now, I don't know if it's guaranteed. I don't know where they're at with their studies. They're not giving us a lot of information to the public, but this started in 2019 where they're going to use stem cells to reverse type 1 diabetes.
I mean, that would be amazing. I guess I'd be in the same boat that you were saying with your TMJ, where it'd be like, if you have the access, then there's nothing to lose.
Yeah.
Why not? You know?
Yeah.
Is that something you guys treat?
Which one?
Type 1?
Not really. If I knew what type of stem cells they were doing, I could probably do them, but I don't know what they're doing. And I doubt they're going to tell anyone.
Yeah, right. I know it's probably patented. Like, just keep the thing secret. Yeah. Professional, you know, intellectual property.
Yeah.
What kind of stem cells, what are the options, the variations of stem cells? Like, what exactly is in the injections for that?
So let's take a step back for a second and say, what is a stem cell first? So stem cell is a marketing word through and through. Basically what happened is the guy that found quote unquote stem cells in the 90s, he called them a stem cell because he thought they could do anything. And then like 5 years later, he came out and said, they're actually not stem cells. They're called MSCs. They're basically signaling cells. So when they're placed wherever you're going to place them, they tell your body, hey, this is really injured or inflamed or whatever, come fix it. They're basically the instruction manuals. But when he changed the name, the original name stem cell stuck and it kind of just continued on.
Yeah, because I always thought it was like undifferentiated cells that when you inject in the area, they take on the characteristics of those cells.
Correct. That is a true stem cell. The problem is what we're concentrating, harvesting now doesn't do that.
Okay. When did that shift? Or has it always been like that?
It's always been like that. It's just no one understands the terminology. And so everyone stem cell sounds better than MSC. So everyone kind of just stem cell.
Yeah.
So, you know, 5 years later, they've always been the same cell. They've just changed the name. He keeps changing their name. Every like 5 years comes out a new name for him. But so areas you can get them from: birth products. So placental tissue, umbilical cord blood, amniotic fluid. That has it. That's typically what's donated when you get from someone else. Then you can get from yourself, out of your blood, called V cells, out of your fat, that's usually called adipose, and out of your bone marrow. So at some point in my career, I've offered all of these things. So the main difference is that as you age, your concentration of cells goes down. So bone marrow, adipose, they just decline. And so back when I was offering adipose and bone marrow, if you're over 60, I would do my best to talk you out of using your own. Yeah. The counts and quality aren't the same.
What's the threshold for that now? Would you say 35 to 40, still 60?
Age, still 60.
Oh, okay.
They've done studies. By the time you hit 65, if you compare it to an 18-year-old, you're about 1/10 of where you should be. Compared to a newborn, you're like 1/100th.
Wow. Wow.
So You can do them, but honestly, compared to donated stem cells, which I'm talking about, I never saw amazing results with bone marrow adipose. They're just not as strong. So now we get back into donated. Like I said, they're placental, umbilical cord, or amniotic. Amniotic has pretty much fallen out of favor. They're harder to harvest. They don't seem to work as well. They don't come with as many growth factors. Because that's the thing, besides the MSCs, there's also a bunch of growth factors that come right along with it that when we inject, you get all these things. And they're more like, if you're building a house, they're like the lumber and the nails and all that.
Okay. What are are they proteins? Are they
growth factors?
Yeah.
Yeah, they're amino acids, cytokines, and proteins.
Okay. Cool.
So now we get back to injections. So if we talk specifically about joint injections, there's two different variances for it. There's what most people use, and then there's what a select few, including me, use. So most people use something that they just call MSC stem cells. They're basically, they take umbilical cord blood, they concentrate out the cells to whatever number they want to get to, and then that's what they're injecting. It's fluid-based, it's cells, tell your body, hey, this knee is really injured, there's arthritis in here, come try and replace some of the cartilage.
How is that? I mean, articular cartilage, avascular, aneural.
Yep.
Is it grown from the subchondral bone from underneath down? You know, like how does that work?
So yeah, it's basically trying to signal the body to grow more of it from inside out. That's why MSCs, I don't think, work as well. Now, do they work some of the time? Absolutely. But did I ever really see imaging changes with umbilical MSCs? Not really.
What do you see image changes with?
So this is the product I use for direct injections. It's a placental tissue allograft. So it's actually a surgical product that I've adapted for injection. They take a placenta and grind it up for me and give me little bits of tissue. So when I inject it, it acts as a true tissue graft. So like, I don't need your body to regrow cartilage. I literally put it in there and your body kind of just stitches it into place.
Interesting.
Closest thing to surgery without having surgery.
And that would be something like knee arthritis, lumbar spine arthritis.
You name it.
Shoulder arthritis, whatever.
Yeah.
You would inject it in the joint space.
Yep.
And have pre-treatment MRI imaging.
Yep.
Post MRI treatment imaging.
Yep.
What length, and you would see improvements in the cartilage thickness, vibrancy.
Yep.
Smoothness.
Yeah. So I have a lady, hers came back, hers was super cool. Came back about a month or two ago. I saw her last year. We did stem cell injections into her hip. She had it wasn't fully circumferential, but she had a anterior to posterior labral tear. So basically like the top half of her labrum was torn. And she had a bunch of glute tendinitis and tendon sprains and soft tissue defects and all that. It's completely gone.
It's amazing.
The labrum the MRI report for the labrum said no labral tear detected.
Wow. That's amazing.
Yep.
What about cartilage, like articular cartilage?
So, yeah, I've seen, especially in these, I've seen it reverse. I've seen grade 4 arthritis reread a year later as grade 1 arthritis.
Oh my God.
So 1 is mild. Most people have that. Grade 4 is severe, ready for surgery.
Yeah, of course. So what does that protocol look like? So someone comes in and say, I have knee OA or hip OA or osteoarthritis.
Yep.
And I'm debating hip replacement or knee replacement. Doc says, orthopedic surgeon says I need that. Grade 3, grade 4. It's like, all right, come in, we'll treat you, we'll do our protocol. What's that look like? Like, what do you do? It's the placental
placental
tissue graft injections.
Yep.
For let's say like medial knee OA, or let's say medial and lateral, both.
Yep.
How many injections would that require?
So,
and then how long until you'd be like, let's do another image and see if it worked? Mm-hmm. How long does that take?
Yep. So injections. So when I inject, this is another thing that I do that most people doing stem cells don't. When you look at knee's a great example. When you look at a knee's supposed to bend like this, right? And you have a bunch of ligaments all around the outside. They're supposed to make sure it does this. When those ligaments start to get injured, the knee starts to rock a little. And then that's how you get meniscal tears and LCL and MCL injuries and ACL eventually. All that. They start to tear from instability. So when I treat, I find everything that's unstable and I treat that LCL, MCL, patellofemoral ligaments, coronary ligaments, whatever you need, I will inject those as well. And then I do the joint space, meniscus, ACL if needed. So the number of injections varies on not just the arthritis, but also what else is surrounding.
Surroundings, lack of stability,
Yeah.
support structures, soft tissue.
Yeah, if it's just arthritis, one shot.
One shot.
Yep. And then if you have something really wonky in your knee or your shoulder, I can do an arthroscope in office and actually put a camera in there and bring the needle right through under camera visualization.
Wow. How big is that camera?
Are
they awake for this?
I usually sedate. I actually have had a couple people do it awake. They're patients that I know really well and have injected a whole bunch before, and
they're
trust
used to
them.
that.
Yeah,
because you can't move.
You can move. I'm just worried about them passing out.
That's true.
So the camera, it's about 2
Would
millimeters.
you local anesthetic then?
Oh yeah, no, we numb it off really well, and I typically will give them an oral sedative as well, just to cut the edge. Anyone that's listening to this podcast that I don't know, you're gonna be sedated for this.
Like full anesthesia.
We use ketamine for sedation, so it doesn't affect your respiration slice. Basically puts your brain into a dreamlike state, and then you can't move for about 30 minutes. So
are they like kind of aware?
No.
Like, is it like sleep paralysis?
Not really.
Have you been under like that?
No. Have I been under ketamine? No, not yet. Because who's going to inject me if I go to sleep?
Yeah, it's true.
No, I get to do my own injections awake on myself.
Okay. We'll talk about your hip and yeah. So yeah, all right. So ketamine, I was gonna say like, because have you ever had sleep paralysis? Never had it before, man. It's weird, you know. You can't move, but like you're asleep, but you're also a little bit awake. Mm-hmm. And I remember there's a like really quick story. I was in college, all right, and I was there early because it was football camp. Mm-hmm. So I was there before anybody else, and I was at my buddy's house. Mm-hmm. And another one of my friends who's on my volleyball team, right? He came early with me. He just was there early as well. Mm-hmm. And I had like meetings the next morning. I was getting up really, and I was in my upstairs bedroom. He's sleeping in the downstairs bedroom. I was passed out. It's the middle of the night. It's like 3 a.m. All of a sudden, the lights turn on in the hallway. Mm-hmm. I can see the light turn on under my door. I'm asleep, but I have sleep paralysis. I can't move. It's weird. Oh. You just can't move. But I'm like kind of awake. I can see through my eyes. And I'm like, move. Like, just move. Like Kill Bill. Like, move your toe. Move your toe. You can't. The door opens. But I can't really see because I'm like sleeping the other direction. Yep. I hear footsteps come up the stairs. Door opens. Mm-hmm. Door closes. Lights turn off. I don't hear anything. I get up at like 5:30 for like 6 a.m. meetings the next day. Mm-hmm. And I look into the bedroom across my hall and there's somebody sleeping in there. I was like, oh, it's my buddy. Leave, come back later that afternoon. I was like, hey, did you go upstairs last night? He's like, no, I was downstairs the whole time. I didn't wake up. I was like, somebody came in our house and passed out in the room. When I got back, they weren't there. Yeah. So somebody, that's an example. That was the weirdest sleep paralysis. I was aware, but I was still asleep. The thought would be like, this doesn't sound like very nice. It's kind of evil, but the thought would be like sleep paralysis is like if like a demon was kind of like resting on a blanket on top of you and preventing you from moving. But you're kind of like awake. That's
terrible.
I know. That's the old like legend, legend. But anyway, that's what was my question was like.
Now that you've scared your listeners just a little bit. Yeah. No, it's nothing like that.
Dude, I'm just kidding.
No, it's literally nothing like that. You literally, you take a trip to Mars, your brain, you go into hallucination and your brain is just somewhere else. I had one lady, we have so many ketamine stories. I had one lady that wakes up and she goes, you and I have known each other for 1,000 years. We were two 16-foot tall aliens sitting on the edge of a cliff.
No.
Yep.
That's weird, man.
I've had other ones. I had one guy, must have been having a great time. He was asleep. Every like couple minutes, he'd pick his head up, go, can I go dancing? And just lay back down. That was one of the funniest ones I've seen.
Oh my God. It's like 30 minutes.
It's roughly 30. We can control the time to some degree, but yeah, it's roughly 30 minutes.
Wow. That's crazy. And so you do that for all arthroscopic driven injections?
Yeah. And then I actually have a lot of patients that sedate. They're like, I don't want to be awake for all these pokes. I'm like, you don't have to be. Sedation's free. Let's do it.
Wow. So and if someone say I'm getting all these pokes, they're getting multiple sites injected, multiple joints.
If I'm doing your lumbar spine, it's all 5 levels injured, you're looking at 17 injections.
Wow. Mm-hmm. Oh my gosh.
Because it's 3 injections per level, and then they'll do your SI joints as well.
Wow. Yeah. Mm-hmm. So 3 times, that's 15, and 2 on each SIJ. Yeah. 1 on each side.
So wow. 17.
Oh my gosh. So, and you have to go inside the joint capsule.
Yeah.
So those are deep injections.
Yep. So I do them under ultrasound. If you're awake, you can feel me touching the bone.
Wow. Which actually, I mean, with needling, dry needling,
Yep.
right? Which is like way less. I mean, they're tiny little needles.
Yep.
When we needle the lumbar spine, the lamina is like the background,
Yeah.
backdrop we're trying to hit to know we're in the right space.
Yep.
And when I've needled myself, and other people needle me, you really don't feel it.
Yeah.
You feel like pressure
With these,
but you don't really feel. What I mean is like the bone, when you hit the bone, bone pecking, right?
Yes.
You can peck the bone.
Yep.
I mean, you would feel, the insertion of the needle, but the bone pecking itself, it doesn't really feel like anything. It's weird.
It feels weird. Yeah. Now if I do the base of skull, which I'll do for headache injections, like you hear it, like click, 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 click. So that one freaks people out.
I can imagine. Yeah, that's crazy. All right. So the growth, I was going to ask, so the growth factors, those are amino acid chains.
Yep.
And proteins. And then what else did you say? Cytokines?
Cytokines. Yep.
Could a compound pharmacy just artificially create those compounds, or does it have to be derived from a donor?
So I think they've done more studies on PRP than stem cells for this part, but there's over 100 different growth factors and cytokines that are produced in a PRP injection. So could a lab synthesize all of them? Maybe in theory. I guess the same idea kind of as peptides, right? In theory, they could make them, but the sheer cost of them making 100 different ones you have to combine, it's not going to be cheap. It's probably going to cost you more than using your own.
Yeah. And there's plenty of placental donated stems, growth factors we could
Baby
harvest
born every minute.
Yeah, right. Exactly. Why is there resistance still with entities in the United States preventing diving into this more?
The FDA massively.
Yeah.
So medical law, the FDA oversees it kind of for all American. They set standards, but then there's also state law. And so stem cells, like the state of Florida said, you know what? We're going to make stem cells fully legal in the state of Florida. So now we have access to stem cells in Florida. It's the exact same products you can get in like Colombia or Mexico or wherever you go. But if you go,
when did that happen?
Last July 25.
That's when stem cells became legal.
Fully legal in the state of Florida. They've always been. So the way it kind of works is, as a physician, you have the right to use a product for off-label use, right? So historically, what they've always done is get stem cells approved for soft tissue, like wounds, like for burns and stuff. And then as a physician, I can use it off-label to do whatever I want with it. And that's kind of how it's always been. The FDA will come around once in a while and crack down on everyone doing that. And they're like, we know you're not doing this for soft tissue. Everyone's injecting it. You're in trouble. But so last year, Florida said, you know what? Just use them for whatever you want. Free to go.
Who approved that? Like, how did that go through?
DeSantis, the governor, signed it.
The governor, he just like, he just decided.
Yeah, went through the House, the Senate. There was a lobbying group that said, hey, we want this bill to pass. They lobbied.
Who was resisting the lobby?
Orthopedic surgeons mostly.
Really?
Yeah.
I'm not surprised.
Yeah, because it's a big business hit to them.
Yeah, totally.
My entire job is keeping people out of surgery.
Yeah. So. It's like, who's going to be like, you know what you don't need, is my services.
Yep. So there was a couple doctors that lobbied pro. I know one of the doctors that really lobbied for it.
Orthosurgeon?
No, the doctors that lobbied pro were doctors like me that do stem cells, don't do surgery.
Yeah.
And then the ones that were against were orthos.
Interesting. What were their arguments?
It's the usual stuff. Not safe, not proven, not enough studies.
Yeah. Interesting.
I'm like, the whole reason we don't have enough studies is because no one will give us funding to do these studies.
Or even like legal access.
Yeah.
I'd imagine even to do the study. It was like, hey, there's no studies. I was like, we haven't even had a chance to do studies.
So one of the products that we use is under an IRB, which means investigational research board. So it's actually under study to become approved, but it takes years to do that. You need a lot of money, a lot of patience.
Yeah.
And so typically when you put a patient through an IRB study, you give them the stem cells for free. But like most clinics can't afford to give away buckets of stem cells. They'll go broke.
So it's just like discounted.
Yeah.
Yeah. Which Kyle talked about a little bit too.
Yep. Yeah. He knows more about that than I do.
That's interesting. And then all right. I think another one people that I get a lot of questions on is like, the brain stem cell injections.
Yeah.
Which type of stem cells are used for that?
So those are fluid-based MSCs. So that's not the placental tissue. That's not going to pass up. So the way this shot works, it's a needle and it doesn't go up your nose. It goes towards the back of your nose, towards what's called your turbinate. Take your finger, put it in your nose and hit bone. That's what we're going towards. And that bone is porous. And so what happens is the cells will soak through the turbinate, soak through the cribriform plate, and hit your olfactory nerve. And then they'll catch a ride up your olfactory nerve into your brain. And from there, they'll start to self-signal towards areas of inflammation, injury, and go to work healing it. And they've done radioisotope studies on this. Basically, they tagged them and then did x-rays to watch them go up. So we know it goes.
That's crazy. That's really cool. Yeah, the cribriform plate. That's where the olfactory nerve exits.
Yes.
To innervate for your nose.
Yeah, that's where smell comes
for
through.
odor. Yeah. For olfaction.
Yes.
That's really cool. So it rides the olfactory up to the brain, and then like heat-seeking missiles, they target the areas that need attention via inflammatory response markers in the brain. So that would be targeting things like if there's degenerative changes.
Yep.
So yeah, what things would it like does really well with, and what things does it not do well with?
Mild dementia. So if you come when you're like starting to lose words, forget names, but you're not like severe, like, you're not forgetting where you live yet. Those are the best cases. That's when we catch before it gets bad, and we're able to reverse it in a good chunk of cases.
Wow.
To the point that they're like, yeah, my memory's fine now.
Wow.
So post-traumatic brain injuries, neurological Lyme is a really good one as well.
Brain injury, TBI.
Yep.
How quickly would you need to be interviewed? The quicker the better, I would assume.
Quicker the better, but I've done patients that had TBI 10, 15 years ago and it still works.
And they're like, what did you see him?
Big first thing we usually see is pattern of speech changing. So they kind of stop talking like this, where they're almost searching for the next word, and they start talking normally.
Interesting. Wow. That's really cool. What about stroke?
Yep. Done post-stroke as well.
What length of time?
Again, as sooner the better. If you have the stroke, you get out of the hospital and you come see us within a week. That's best case scenario. But again, I've done patients 10, 15, 20 years ago and seen improvement.
What improvements have you seen?
I've seen vision improvements, like stroke affected vision, fuzzy vision. I've seen vision improve. I've seen movement improve, shuffling, loss of motion in the hand.
Interesting. What about Parkinson's?
Parkinson's is a tough one. I've seen tremors improve. I've seen tremors not improve.
So that's just a hit or miss.
Yeah.
I wonder why.
I don't know. To some degree, it might be because Parkinson's is not a hyperinflammatory condition. It might be that signaling towards the dopamine producing parts of the brain isn't as strong. It's stem cells don't flood there necessarily. So I guess if they happen to land there, then they'll heal it. Yeah.
So then they would just be prioritized, and other inflammatory spots didn't know was already inflamed, or had an issue, and that maybe a dementia issue or hearing loss. I mean, like, or whatever area in the brain.
Yeah. So, I mean, I could tell you a really good story about that one, just about how stem cells kind of figured themselves out. So I had a lady, this was years ago, and she'd been seeing me for a while for IVs and stuff. And she's like, I really want to do IV stem cells. I'm going to save up and do them. And I was like, okay, what do you want to do them for? She's like, well, I have really bad brain fog. And I also have neuropathy in my feet, but really I want the brain fog to go away. And I was like, listen, I can't, and this was before I was doing intranasal. This is before really anyone was doing intranasals. So I was like, listen, I can't promise you where they're going to go. They're going to go somewhere and heal something, but who knows where it's going to be. And she's like, well, I'm going to do them. My brain fog is going to be better. I'm like, okay. So we do her IV, disappears for about a month, 6 weeks. I see her. When she comes back, I'm like, so how'd the stem cells go? Did they work for you? She goes, no, they really didn't work for me. I'm like, oh, really? She's like, yeah, I really have bad brain fog still and still trouble thinking, forgetting. And I was like, listen, did anything at all change? She goes, yeah, the neuropathy is gone, but I really didn't care about that. And I was like,
great.
Well,
that's a win, right? Like
that's a massive win. How often does neuropathy go away?
Yeah, seriously.
So,
and that was an IV.
That was IV. Yep.
Yeah. Okay.
So now what we know now, so the guy that started teaching intranasal started teaching them about 5 or 6 years ago. So that's what, now if someone comes to me like that, I'm like, intranasal for brain fog, IV for neuropathy.
Yeah. Interesting. So did she end up doing the brain injection?
I don't know. I think she stopped coming at that point. So I don't know where she is now.
Wow. But that's cool though. I mean, neuropathy improved, you know? And then another personality wise, would you ever see like if there's like some kind of TBI
Yep.
or personality change from stroke, maybe.
Yeah.
Like, does that see improvements?
Yeah. So actually, I got a really good one. He saw him last year around this time, actually. 17 years old, had 2 or 3 concussions from falling off a skateboard. Also had neurological Lyme. And so
From what?
neurological Lyme.
Yeah, from what?
Lyme, like Lyme disease.
What it means, like from a tick or from a...
Yeah, from a tick.
So he got a tick bite.
Yeah, he got bit when he was probably like 8 or 9. And no one connected the dots until I tested him for Lyme. I was like, wait, you have Lyme. So we started treating for Lyme, and he was getting somewhat better. And his parents were like, you know what? He's not going to graduate high school if he doesn't like get his stuff together and finish these last couple months. So I guess it was actually earlier in the year. If he doesn't get his stuff together and finish, because he's skipping classes, he's not doing his homework, nothing's happening. And they're like, we want to do intranasal stem cells. And so we do his injections. And literally, he calls back next day, and Carly was talking to him, and she was like, "Oh my God, your voice is completely different. Like you were talking normally, and like he was stringing together sentences because he was talking like that example where he talked really slow and would pause like every 3 words." So he graduated high school. So that was
amazing
for him.
Yeah. What comes up on the Lyme test for you to be like, oh, you have Lyme?
So Lyme is a whole thing, right? Lyme is. Put on your tinfoil hat on this one, but because you can test for Lyme through Quest or LabCorp testing, and they do a PCR test, which is a quick and cheap way to test for Lyme, but it misses the Lyme unless it's like usually a recent tick bite. Lyme will go dormant at some point, and then it will like have reflare-ups. And when it has those reflare-ups, PCR tests almost always come up negative. So there's specialty labs. There's a bunch of them: Vibrant, IGenix, Galaxy, a couple others. But they usually do either something called FISH testing or IgG antibody testing. There's a few different ways, but you can actually see markers for Lyme coming up and co-infections.
And then what, like on the paper, it's like, what would be elevated? It just says Lyme check mark.
So the company I use is called Vibrant. And so they look for, there's different signatures Lyme can have, different basically proteins it produces. So it looks for like 20 different proteins and it's basically looking, are you making antibodies against it? Are you trying to fight it?
And if those antibodies are present, it represents Lyme is effect. I gotcha. Mm-hmm. Epstein-Barr.
Yeah.
I mean, I had mono when I was a freshman in college.
Most people have.
Is that that's the thing that sets off Epstein-Barr for you? Like if you have mono?
Yep. So it's kind of like chickenpox becomes shingles.
Yeah.
Mono becomes Epstein-Barr.
Okay.
And so you get mono, you're sick for a week or whatever, unless you're that one kid everyone knows that was sick for like 3 months.
I was like a week.
Yeah. Most people
5 days.
Most people.
I was on my deathbed, man. I felt
really?
the worst sore throat of my life too.
Mm-hmm.
I mean, I couldn't swallow. I lost a ton of weight.
Yep.
Yeah. What's the worst stuffy headache nose I've ever had in my life? I was crazy.
Mm-hmm. Mono sucks.
Yeah.
But then everyone's like, oh, I recovered from my head in high school. Never think about it twice, right? But it can become Epstein-Barr. It basically stays in your lymph and your nervous system forever. And it's very opportunistic. You get stressed, you get super sick. COVID reactivated for a lot of people. It will flare back up. And then it has no physical symptoms. That's what makes it worse. Fatigue, brain fog, inflammation.
Interesting. And what would, same thing, antibodies would show up on a blood test indicating that those are only present if Epstein-Barr.
Yeah, that one, it's really easy to check through Quest. You do something called an EBV early antigen test, and it shows you if it's active or not.
Interesting. So then what do you do?
Personally, for my patients, we do EBU therapy.
EBU?
Yep, works really well for it.
And that's like a dialysis type of filtration treatment?
That's ozone blood filtering. Okay. So we basically take your blood out of one arm, we clean it, we ozonate it, we return to the other arm.
And let's say, well, how many treatments of that would it be like you eradicated your Epstein-Barr?
So you can never eradicate it. You can only push it back into suppression. It's pretty much impossible to get every trace of it. Usually 3 is enough for most people. If the Epstein-Barr is really, really bad, which the number tells us, occasionally need more treatments.
Interesting. So, and it'd be enough to where it's like, it's non-detectable right now.
Correct. Yep. Get that number under 9 is the benchmark for it. So get it back under 9. You stop having fatigue, brain fog goes away.
And then like, have they done any long-term studies where 5 years later it flares up again or it proliferates, or is it like it's pretty static at forever?
There's no There's no long-term studies on it, but I can tell you for my patients, I have patients where there's reflares every like 6 months. I have patients that reflares once every like 5 years. So it kind of just depends. I think it depends how strong your immune system is, how good you eat, quality of life, all that stuff ties into it.
Stress. Interesting.
Mm-hmm.
What else is Ibu good for?
You name it. So let me explain it and then maybe that'll help. So we take blood out of one arm, we run it through the machine where 4 things happen, and we return to the other side. So 4 things. First, your blood hits a filter. It's actually a dialysis filter. So it filters out microplastics, glyphosates, pesticides, environmental chemicals, molds, parasites. That's all things we've seen. Ozone is fed into your blood, hyperoxygenates your tissue, promotes healing, decreases inflammation, and stimulates your immune system to fire. Inflammatory waste will actually capture trapped in a bucket down below. So we physically remove inflammation from you and throw it out. I've had patients lose like 2 or 3 pounds in an hour from just water weight.
Wow.
Then we run your blood under an ultraviolet light, which basically further kills inflammatory cytokines, and then back to the other arm.
Wow. That's cool. And it takes like 3, how long does one treatment take?
About an hour.
Okay. So it's like, and then you wait a week and do it again, or
Exactly.
just a week in between?
Yeah, that's typical. I like to do is once a week for 3 weeks.
And then after that, people report way better focus, brain fog, inflammatory aches and pains.
Yep. Yeah, like I had one guy a few years ago. He had arthritis in both shoulders, arthritis in both knees, arthritis in both hips. He was a carpenter. And he was like, well, am I going to replace all these joints? And so he came in, his wife wanted to do an Ibu, so he did one with her. And he's like, wait, my pain's gone. And then he comes back in a month. He's like, I want to do another Ibu. I'm like, why? And he's like, well, my pain was gone for 3.5 weeks. So I want to see if it happens again. So he did it like once a month for like a year. And so like pain would come back at 3.5 weeks to do another Ibu. And so it kept him out of pain for a year. And then he retired. So I guess the pain stopped. Yeah.
Yeah, hopefully enough. Interesting. I wonder in that situation, it just inflammatory cytokines would be suppressed and removed. Mm-hmm. And then it would recognize the presence of this articular degeneration and spike again and then come back down again.
Yeah. Well, I think he was working. So he was grinding.
Yeah. He's also just like pushing it.
Yeah.
Yeah. Gotcha. Okay, and then I know parasites, right? Mm-hmm. So you mentioned heavy metals, pesticides, mold, parasites. What else? Chronic, that lead to like chronic issues. What was the other one? Was there one more?
I mean, so Lyme, Epstein-Barr, mold, heavy metals,
Lyme
parasites.
And Epstein-Barr. Yeah. So we talked Lyme and Epstein-Barr. Mm-hmm. For parasites. What's the treatment? What would make me like, you know what I think you have is parasites? Let's treat parasites. So
I spent like a year doing parasite testing on pretty much every patient that came through my door. Everyone was really into this experiment.
Yeah.
I didn't have a single negative parasite test come back.
Okay.
So everyone has parasites.
Which we knew, like I was aware of that. I guess the question is like, are there different types where it's like, this is an issue, we need to treat that? Or like you have parasites, but they're okay, they're good.
So the thought is there's no good parasites to have. So the rest of the world does parasite cleanses twice a year. In America, we parasite cleanse our animals, horses, dogs, cats, you name it. Everyone does parasite cleanses, but we don't parasite cleanse ourselves. Why? Who knows? You eat pork, you're getting parasites all the time. If you eat ocean fish, you're getting parasites. You want to do a really cool experiment? Take a piece of fish that you buy at the store, put it into like a Tupperware or something, and pour seltzer over it. You can actually see parasites float out.
What should you do that before you eat fish?
I mean, probably it gets them out, but that's how patients.
But if you cook it, does it kill them?
In theory, it kills all the parasites. Yeah, if you cook it all the way through.
So sushi would be the issue.
Yeah.
Interesting. Do you eat sushi?
I do. I'm very much a do as I say, not as I don't.
Yeah.
I'll eat sushi, but then I'll go do an Ibu, I'll do a chelation, I'll take some anti-parasite meds and be fine.
How often would somebody need a parasite cleanse? Depending on like if they eat a bunch of raw fish, probably more often, or is it like once every decade?
I recommend twice a year.
Wow. Mm-hmm. My gosh.
Yeah.
And then what's the treatment for that?
So
with pills?
There's supplement based called Cellcore. It works amazingly. You talk to people that have done a 4-month Cellcore parasite cleanse, and this you probably don't have to do like once every few years. And they're like, I was pooping out worms for a week. So that works really well. And then there's also prescription driven. I've come up with, it's like 3 medicines that cover pretty much all parasites found in America. So you take one at a time. It takes about 2 weeks to finish.
Wow. And then you're pooping out like parasites or.
With that one, you don't really poop out parasites. Patients tell me that, wait a second, I didn't realize I had brain fog, but now I feel better.
Wow.
Mm-hmm.
Yeah, I was gonna say, what are the symptom reliefs that people report?
Yeah, usually gut, bloating, better digestion, better bowel movements, and then brain fog.
Wow. Okay, so that's parasites. And so those symptoms would indicate like we should investigate if they're bloating, IBS,
Yep,
brain fog. It's like we can investigate parasites.
yeah, always.
And then mold.
Yep.
What's the symptoms for that, and then how do you treat that?
Yeah. So mold wants to turn you into mold. That's kind of how it works. It wants you to be fat, eat a bunch of food, especially sugar and carbs, be really depressed, sit at home, and just sit there and reproduce more mold. So fatigue, brain fog, gut issues, bloating, diarrhea, sometimes nerve pain. Those are all common mold symptoms.
Interesting. Yeah, well, how do you treat it?
So the way you treat mold directly, it's called itraconazole. It's a prescription. That is like the gold standard for treating mold. You do it for anywhere from 3 to 12 months, depending on how bad your mold is.
My gosh.
There's also supplements for mold, but a lot of supplements rely on your immune system to work, which means that if your immune system is weak from other things, it's going to have trouble killing the mold. You get a lot of side effects.
Ibu effective for that?
Super effective.
So Ibu also with parasites?
Yeah.
So it'd be like take these cell core meds or the 3 meds you were talking about and do Ibu.
Yep.
For parasites.
Yeah. So Ibu, we've seen parasites floating in the waste bucket. Like if you look really close to the waste bucket, you can see microscopic little parasites.
Oh my gosh. And then for mold, same thing. Take those pills and do Ibu.
Yep.
Anything else?
That's pretty much it. So one caveat to that, if you're full of heavy metals, mold becomes really hard to kill. The reason for that, they did studies on this. Mold creates a biofilm to survive in the body, basically like a little protein shield around itself. And it's able to use that shield to repel antifungal agents. And so they're like, how on earth is it doing this? It shouldn't be able to. But what they figured out is it binds to a heavy metal, borrows the charge from a heavy metal, and uses that charge to kind of push away antifungals.
Interesting.
So if we have patients with chronic mold and it's not responding to meds, well, we'll get into heavy metal testing with them.
Yeah. So you got to rid of the heavy metals first.
Yep.
Then you can dive into the mold. What's the heavy metal testing? Just tests for that blood work, and then what's the treatment for that?
So it's actually not blood work; it's urine-based testing.
Oh, okay.
So this gets in genetics. So MTHFR and a couple of other genes of methylation genes, one of the things they control is your ability to recognize a toxin as a toxin. So like if you're genetically varianced, your body sees mercury, doesn't realize it's mercury, actually thinks it's a mineral called molybdenum and tries to keep it. The reason for that is minerals in the body, they work on a key and hole receptor system, which means as long as the teeth on the key match the hole, it doesn't matter it's on the tail end. So like lead and calcium have similar teeth. Mercury and molybdenum have similar teeth, and it goes on. So your body sees mercury, thinks it's molybdenum, and puts it into tissue. So it's not floating in your blood. So we do what's called a urine provocation test. Basically, we have you pee in a cup that shows us how much heavy metals you pee out on your own. Then we give you an IV of a binding agent. It's called chelation. It takes about 30 minutes. Then we have you collect urine afterwards for 8 hours. And so that's going to show us how much metals are trapped in your tissue that we can make you pee out.
Interesting. Well, great.
Yeah.
Yeah. And then what are the reports on that? Like I feel less brain fog.
Oh, heavy
bloated.
metals. Each metal causes different things. So like Alzheimer's is linked to Alzheimer's linked to aluminum, so a lot of brain issues. Arsenic is linked to kidney issues. Cadmium is linked to liver issues. Gadolinium is a neurotoxin. Mercury is brain, thyroid, gut, nervous system. Lead is heart, bone, hormone, and brain. Thallium is another endocrine disruptor. So each one's kind of unique.
And the treatments for this would be?
The more of those IVs that we give you for the tests, you just do a series of them.
And it rids of all, like it's universal for all of them?
Yep.
And it'll just rid the ones that are
high.
Most high.
Yep.
Interesting. I was going to ask too about the pre and post imaging. Let's say like degenerative changes, brain, and with Alzheimer's.
Yep.
Right. Treatment for that then sounds like it'd be aluminum.
So I get into heavy metal testing with Alzheimer's patients. Some do, some don't.
And then brain stem cells.
Yep.
And would that like help rid or just work around the amyloid plaques and neurofibrillary tangles that are found in imaging for Alzheimer's?
Yeah, so stem cells, they're not going to be able to eliminate those tangles. There's a few different IVs out there that can. One is IV methylene blue. It's actually said to be able to cross the blood-brain barrier and bind to them. And then there's a few new like traditional meds. One is called TB006. There's starts with the C. It's like Concerta or something. There's a third one whose name I can't remember, but they actually can go up to the brain and bind the tangles and remove them. But what's interesting about those meds is they only seem to work while you're doing the treatments. You stop the treatments 2 months later, symptoms start to come back.
Really? Wow.
So that's why I'm like, if stem cells, if they work, they don't always work, but if they work, you're not committed to doing them the rest of your life.
Yeah. I wonder if I would imagine both treatments simultaneously, where it's like if you did that IV with the methylene blue, and then stem cells through that process, that would be really effective, it sounds like. Yeah. And then also like, and then aluminum.
Yeah. So heavy metal testing. Yeah. I've actually, years ago, I had a lady with Alzheimer's. She was to the point her husband took away her keys. She wasn't driving. She could only go in places with him. They couldn't really afford stem cells or anything. They're like, listen, test her for heavy metals. Let's see. And so he was a plumber, so he was exposed to all sorts of garbage. He worked with them and all that. So we tested her aluminum and her mercury were both really, really high. So we did a bunch of chelations on her, like 20 or 30. But by the time we were done, she was driving again. Wow.
So market improvements on cognition, memory, personality.
Yeah. Yeah. Oh yeah. He's like, she's actually crying less. She's more emotionally stable.
Wow. Cool. How old was she?
70s.
Early mid 70s.
Yeah, something like that.
Wow, interesting. That's cool. So the last one would be, so we did parasites, mold, heavy metals, Epstein-Barr.
Yep.
I guess autoimmune, like there'll be the IVs for autoimmune.
Yeah, autoimmune gets more complicated. Depends what autoimmune it is, because that's a massive field.
We don't have time for that because it's super interesting. Yeah. But like multiple sclerosis, RA. Yep. Those would be autoimmune. Yep. Similar? Are those similar? Which ones are similar?
Those are two completely different ones. So you have the ANA driven ones, which is like lupus and like the connective tissue disorders and all that stuff. That's kind of one path. You've got MS, which is its own thing. Then you've got RA, which is its own thing. So RA, you can't stop it, can't reverse it, but there are IVs like DMSO and Procaine and all that calm down the pain and stop the inflammatory cycling. Okay. MS, I really get into heavy metals, ozone, and stem cells. And then you get into like the ANA driven ones, and that's usually heavy metals. If not heavy metals, I don't have a great answer.
I was gonna say, because like you were saying, some were neurotoxins. Lead? No, thallium,
gadolinium, and mercury.
Wow. Yeah. Interesting. We'll dive into that more. And then yourself, right? You said you slipped and fell and broke your greater trochanter.
Yep. So that was
a plate put in and a rod down your femur. Mm-hmm. And that was 6 weeks ago.
That was 6 weeks ago now, yeah.
Yeah, and you're walking good.
For about 2 weeks now, I've been walking pretty well.
That's awesome. What did you treat yourself with?
A lot of IV stem cells, direct stem cell injections, and then a lot of peptides.
So the direct stem cell injection, the same way we were talking about before, with the plate, the placental tissue graft type?
Yeah, so I had, when I fell, so I've done stem cells kind of just in the soft tissue around there, just because I think some muscles tore when it broke. And then also something tore on my fibular head. And so that pain was actually worse than the hip pain. So I ended up having to do 2 different rounds of stem cells on the fibular head.
Interesting. You think your LCL, your biceps tension?
No, I think it's, there's that ligament that goes from fibular head to the tibial plateau. Yeah. That's what tore, I think. Okay. So I treated that. But
interesting.
Yeah, really.
So intra-articular injection, you just did awake.
I didn't go intra-articular. I did soft tissue. Okay. Kind of just like I did the quad attachments and the IT band and all that.
And then IV stem cells. Yep. What else did you have improvements? Do you do that often yourself?
IV stem cells once a month.
Once a month. Mm-hmm. What do you notice the most for that for you?
So with me, I've done so many of them at this point that I don't get so people, when they do them infrequently, they get like a big buzz off them. They feel really, really good. I don't get that so much anymore. But what I kind of feel is like, I'll feel them hit like a different organ almost every single time. And so like one time I know, because my neck was starting to bother me, and I was like, maybe I should go do some more injections. It's been like 10 years. I did IV stem cells. I actually had like a headache, like tension headache for like 2 days, then went away. And actually neck pain went away too.
Cool.
Sometimes they hit muscle. So,
And then I would imagine peptides, you did the BPC 157 TB 500.
yep, I'm on that one. I'm on GHK copper. And then it's an experimental one called folastatin. Because 2 weeks after I broke my leg, I bought a home gym and I've been working out 3 times a week now. And so folastatin helps you build muscle about 3 times faster than you normally would.
Oh my gosh.
Yep.
So that's going to be a game changer for the bodybuilding or sports.
Yeah.
Wow. And that's experimental at this point still?
Yeah.
And aren't they all experimental?
Yeah, but folastatin's experimental to the point, like I can get some compounded from compounding pharmacies and it's great. Folastatin, compounding pharmacies don't do yet. They probably will over the next few months, but
Where do you get it from then?
I get mine from Bio Longevity Labs. It's like for research use only.
Interesting.
So
I remember, myostatins, right? Those are the cells that inhibit
Yes.
muscle growth.
So folastatin turns off myostatin. That's exactly how it works.
Interesting. Like the Belgian blue bulls that are like massive. Have you seen those? Yeah.
Yep.
But this is the only mechanism to really inhibit that for humans.
Yeah.
The folastatins.
Yep.
Wow.
So to give you an idea, when I first started chest press, I was 100 pounds. I was struggling. I'm at 140 pounds. I've been on folastatin for 4 weeks.
Oh my gosh.
So
This could be insane.
Yeah.
Like, one question is like, what does the NFL look like, in 5 years?
they could test for this one. So
this would be like
most peptides are banned in professional sports leagues.
Okay.
So they're not allowed to touch them. Now the enhanced games, I'm sure that all those guys are gonna go.
Yeah. Have you been watching that?
I've seen little bits.
I've seen bits. It looks crazy, man. We'll see what happens.
Yeah.
All right, man. Well, thank you for coming in and sharing more insights on this stuff. I always think it's super interesting and super cool. And last question: what on gene therapy?
Yep.
Genetics. Is there a direction with that? Do you think in functional medicine?
Oh yeah. They're already
like altering gene,
altering genes or using genes to guide treatments.
Both.
So using genes to guide treatments is already happening. They can do a genetic test on you and tell you which antidepressants are going to work better on you based on your genetics. Okay. The same thing applies for most medications nowadays.
Could you like trip a gene to turn off while intervening with a medicine,
You're getting into CRISPR technology now. I think that's coming. And within the next decade we'll be there, but they're not there yet.
Wow. And then, altering genes.
Mm-hmm. Yeah, that's all CRISPR technology. Oh, okay. So they want to do that, but they're not there yet reliably.
Yeah. Wow. Well, it's crazy though. I just hope it's not abused, Well, it was humans, right? Like,
yeah.
All right, man. Well, thank you for coming in. And if people want to reach out, what's the best way to get in contact with you guys?
So our website is thelcoa.com.
The LCOA?
Mm-hmm. Longevity Centers of America.
Okay. .com. Mm-hmm. That's the best way, just website.
Yep. Website, got their phone number, email, or Instagram. Everything's on there.
Cool. Awesome, man. Well, thank you for coming in. We'll have to catch up again on other stuff too soon.
Absolutely.